Taste with Rick Simone, focusing on fine dining in East Greenwich, but also checking in with with a wine industry expert out in Napa Valley, getting the take as to what's happening out there with the wildfires and its impact on the industry, bringing it right to you here in Rhode Island. So I appreciate Rick being on the Taste and bringing that right to us here. A lot going on in Rhode Island today. No shortage of politics, that's for sure. A few things happened. Fats Domino passed away at the age of 89. The story on Go Local is his time in Rhode Island. There was a little history there of riots at the Naval Station in Newport, so check that out. Central High School incident that was caught on tape, we have up on Go Local. They are investigating an incident between a student and an administrator. The administrator has been placed on leave. And of course, politics. The big story today was a back and forth between a customer and a restaurateur down in Narragansett. So be sure to check out all the news that's on Go Local. But we bring the news right to you here, and around the corner is Ray Lavoie with the Blackstone Valley Community Healthcare Centers. I appreciate your coming in today.
Oh, it's great to be here, Kate.
Healthcare is front and center right now here in Rhode Island with everything that's going on, with looking at what happens next with Care New England. Will they enter into a partnership with partners? The closure of Memorial Hospital, but wanted to bring you in to talk about the unique role of the community healthcare centers and specifically Blackstone Valley. So tell viewers a little bit about your path and tell them a little bit more about what it does.
Well, Blackstone Valley Community Healthcare has been serving Pawtucket and Central Falls since approximately 1976. We provide primary medical care, behavioral health, dentistry, and optometry. And as far as Memorial is concerned, we've been partners with them for a long time. We've partnered, with residency training, with OB fellowships. We're very saddened to see what has happened to them, but want to stress that we are still strong and growing in Pawtucket. As a matter of fact, we're building a brand new 47,000 square foot facility in Central Falls.
And is this station?
This is the neighborhood health station. This will be the first neighborhood health station in the country.
So we want to let folks get a little picture of the rendering. We'll have it up online after for you to check out as well. But we want to talk a little bit about the model, Ray. This kind of got underway this year, expected to complete construction next year. Why this station? Why this approach?
Well, Michael Fine has joined the staff, and Michael Fine truly is a visionary. He has his own ideas about health policy, and he feels that what the state needs, rather than a hospital system or a hospital-based system, which he likes to call a sick care system, he really wants to build a healthcare system. And a healthcare system will be built of components primarily of primary care components, behavioral health components, and dental components. And he envisions 100 such neighborhood health stations around the state, and he thinks that costs will drop or lower and outcomes will naturally increase.
Now, did I see on the website, was there a picture of a pool? Is there a lot of rehabilitation, preventative care? What will be offered at the station?
Well, the health station, as is currently conceived, will attempt to provide 90% of the services that folks in Pawtucket and Central Falls need.
Wow.
And we're attempting to serve 90% of the folks in Central Falls. We are in 7 sites in Pawtucket and Central Falls, but this is going to be our crowning achievement. His early thinking had physical activity as a key component of a neighborhood health station, but there just wasn't physically enough land to do much with soccer fields or gymnasiums. Maybe that will be a phase 2, but it won't necessarily be on site. But here at the Central Falls Neighborhood Health Station, we will have physical therapy, occupational therapy, maybe some speech therapy. We will have walk-in urgent care, so to speak, and primary care. For the first time, Blackstone will be able to offer dental services to the residents of Central Falls, and also a good, strong behavioral health department. In addition to that, we will have an on-site pharmacy, and so, the folks in Central Falls, a goodly percentage of them don't really have private transportation, and it'll be great to have this one-stop shop right in the middle of town.
I was going to say one-stop shop, pharmacy on hand. Will this soup to nuts be able, as you said, to address, 90% of, you think, of the needs of the healthcare within the community?
Yes.
Now, as you said, you've currently got satellite, you've got different locations throughout the community. What will become of those? Will those still be in existence, or will it be wrapped up into this one?
Well, the 2 in Central Falls will become wrapped up into this. We purchased the Notre Dame Hospital campus from Memorial in September 2015. Central Falls Health Center was already on that campus. We're going to move the Central Falls Health Center into the new health station, and the operation from Notre Dame into the new health station, and then happily demolish the old Notre Dame building.
Happily demolish. What do we think is going to become of the physical location of Memorial?
I think that's anyone's guess.
Anyone's guess.
There's whatever I've read in the paper. They're going to attempt to keep a primary care presence there. They have some beautiful facilities that house the residency program, both in internal medicine and family practice medicine. There's also some talk about moving that to Kent, but we want to reassure the residents of both Pawtucket and Central Falls that we are there with low-cost, high-quality primary health care.
I mean, when situations like this present themselves, there's opportunities in times of crisis. Did you envision the hospital system in the state getting to this critical juncture that we find ourselves at in 2017?
Well, let me just say this. I mean, we have known that they've been in distress for some time, and when this health station was on the drawing board back in December and January of 16, that's when the hospital announced that they were pulling back and moving maternity to women and infants. And also I think they were closing the ICU. I don't remember the particulars. But at that point, we grew this building substantially from 30,000 square feet to 47,000 square feet. We just had an inkling that the world needs more primary care, more preventative care, because the hospitals might not be there as they have been in the past.
Well, we've had Dr. Fine here in the studio on a number of occasions. He's a great brain to pick. He's so knowledgeable in the industry. He talked about even the politics of it, how difficult. He mentioned the occupancy rates of hospitals and beds. How difficult is it for especially leaders in the state to say, maybe we don't need this many hospitals?
Well, he's always complained about the lack of an overall state health policy, which I think is a very good place to start. A good health policy would more or less force these events to occur, at least facilitate these events. It's been spoken of for years that there are 200 excess beds in the state.
Yeah.
And of course, if you have beds, you have to staff them, and it's overhead that comes out of the coffers of the insurance companies, and the costs keep going up year after year, and therefore the health insurance premiums continue to rise.
And you're the expert in the healthcare industry. A lot has been talked about the jobs at Memorial. Any opportunity for sort of cross-pollination for folks who might have been impacted by the closing with the healthcare station?
Well, as soon as it's open, we are going to be looking to staff it fully. We certainly expect to create many jobs. I think we're forecasting maybe a total of 80.
Okay.
The jobs related to primary care aren't as numerous as those related to inpatient care. There's all sorts of people needed in the hospital to run it. They're very, very complex organizations. So there'll be some, but importantly, the services we will be providing are those services that we feel the patients need.
So talk with us, we often say, it takes a village to make something like this happen. Who were the instrumental partners? You talk about the vision of Dr. Fine, but this is a big undertaking. Financially, visionary, who was around the table that really made this happen?
Well, there was certainly Mike Fine and our wonderful Chief Financial Officer, Sandy Pottis, and myself. We have a great team assembled. We can move work off to our co-workers while we tackle something like this that doesn't necessarily fall in our job description. But we've been growing the business since I've been there. Since 1990. It's just been growing and growing. The facility on East Avenue is only 5 years old. We thought it would take 5 years to fill it. It was basically twice the size of our previous location. And it took 2 years. We were bursting at the seams after 2 years. So it's almost a build it, they will come model, but you sense that there's so much unmet need that they will come. And furthermore, the state has been very, very generous with Medicaid enrollments, and several years ago they opted in for Medicaid expansion, and that has made a tremendous difference, at least in the primary care world. not necessarily the hospital world, but in the primary care. There are 8 other FQHCs, federally qualified health centers, excuse the acronym.
The lingo, yes.
In the state, with 30 sites. We have 7. There are 8 organizations, 8 FQHC organizations with 30 sites. And in 2016, combined, they saw 165,000 Rhode Islanders.
That's a big chunk of the state.
16%. And this 16% of the population made 660,000 visits. That's a combination of medical, dental, behavioral health, and optometry. So we are there. We're lowering the cost of healthcare. We have fewer emergency room visits. We have lower readmission rates to the hospitals. We have lower infant mortality, reduction in health disparity. So we're there. We've been there for a long time, and we're finally getting recognized for the good that we do.
So before you came on, we were talking just a little bit about, again, that whole group of healthcare centers. I mean, you're focused obviously on Blackstone Valley, but how do you work with the others? Do you, again, share sort of best practices if things have a financial implication? How closely do you work with the other centers?
Well, it all depends. You know, a remote health center down in Westerly, there's not too much we can do with them or relate to. But for example, we host electronic medical records for several health centers, and that's a very, very strong cooperative effort. Not everyone can afford an IT staff, or it's no need for everyone to afford an IT staff. So everybody pitches in, and we get the job done.
So you get the hub and spoke.
We get the hub and spoke.
We know how that model works here at Go Local. So talk with us a little bit. It's started construction.
They've dug the hole and they're starting to pour the foundations.
Do we know how many construction jobs? I mean, this is going to be pretty intensive.
Yeah, well, construction is kind of funny. You know, the cement guys show up first, and then the electricians show up. So all told, you know, I think there's about 50 or 60 full-time equivalents over the course of the project.
Fantastic. A lot of construction going on across the state here in Providence. But you touched upon something that, if you could break it down sort of into those layman's terms, you know, from the approachability standpoint from this healthcare station, you know, folks, it's in their community, they'll touch the same healthcare professionals on, as you mentioned, multiple basis. But explain to viewers how this does lower the cost. At the end of the day, the bottom line, this system versus the hospital system.
Well, the hospital system is constructed, you know, thank goodness, to treat us when we're sick. But our mission is to keep people from getting sick. And if we keep you from getting sick, you won't be in the hospital if you follow the doctor's orders.
That's the important part.
And therefore, the cost to the system will go down. We've been very, very effective at that, lowering the cost for neighborhood health plan, at least for the members that are assigned to Blackstone Valley. We have a wonderful, wonderful track record. We have, you know, in addition to electronic medical records, we have some great population health management tools. We serve 18,000 patients. So 10 years ago, you knew about the patients who came in to visit that day. But population health tools give you the ability to worry about what's happening with the other 18,000 and who you better reach out to get in for care. So it's kind of a C-state change, but it's really, really having an effect.
Speaking of folks that you're keeping an eye on, both between DC and the State House here in Rhode Island, let's start nationally with what's happening in DC right now. What are you looking at and, you know, most concerned about, and what are your thoughts on what's happening in DC?
Well, speaking as a health center, the health center appropriation, we're still waiting for that to be renewed. So we're very concerned about that. Blackstone Valley gets a federal grant of approximately $2.8 million a year, and that's out of a total budget of $21 million.
So significant.
Significant, 14 to 15%, and it's pretty much given to us so we can care for the uninsured.
Yep.
That's where we get the funding for the sliding fee scale.
Okay.
Well, if the Congress doesn't renew the health center appropriation, we could lose 70% of that. And so health centers have been on edge right up through September 30th, which was the end of the last federal fiscal year. And of course, we're still nervous to this day. The Congress hasn't fully saw through to passing that. And then, of course, the biggest threat is coming back with the administration wanting to roll back Medicaid. I think that really is the absolute worst thing that could happen to the country, but also to health centers. It has provided the wing. What is that under our wings? You are the air.
It's the safety net.
Wings, the safety net. Yeah, there you go. Yeah, it supports the safety net. Nationwide, there's 13,000 health centers serving 25 million people, and that's just incredible numbers. I like to point out Blackstone serving 18,000. You try to put that in perspective. I use Full House at McCoy Stadium as a good example, and it's McCoy Stadium only holds 11,000. I don't know if you've ever been there, standing room only, and it's an amazing crowd, and we see 50% more than that.
Okay, that gives you a little idea of how many people come to the healthcare center. And let's talk about a little about the station. I mean, you're so focused, obviously, with Blackstone Valley. But as you said, it's Dr. Fine's vision in part to have this be a model from around the state. Have you talked with other community healthcare centers saying, how did you get started with this? And how might we replicate what you're doing in Blackstone Valley?
Yeah, we're always having discussions. I mean, it's Blackstone Valley, I think, is a little bit of a leader in some of these things. It's very unusual financing that we used. It's new market tax credits, which is a subject for a different conversation.
Subject for a different time.
Very, very confusing, but we have been growing faster than most in the state. The folks are there. We have had the desire to build buildings that meet the demand.
And there you go.
There you go.
2018, we're going to continue to keep a close eye on it. Again, wanted to bring this to our viewers here with so much going on in the healthcare industry, talking about Care New England, talking about Memorial, but what's being done at the community level. So Ray, I appreciate your taking the time to come in today.
Thank you very
I'll
much.
let you take the rendering around the corner. We'll have those online for folks as well, but I'm sure we'll talk soon.
Thank you.
Okay, Ray, take care. We'll let you around the corner. Ray Lavoie with the Blackstone Valley Community Healthcare Centers, again, giving us a little eye-opener as to what's taking place here in the state, impacting a lot of Rhode Islanders right in Central Falls, underway with a new healthcare station that is going to be opening in 2018, talking about this community healthcare center model, where it fits in now in this healthcare world in which we're seeing a lot of chaos in terms of where things are at with hospitals. So giving you another vantage point as we do here in the Navigant Credit Union Broadcast Center. We'll be right back with our next guest, so don't go anywhere.